Doctor, if you could look at this image, which you see right here, and tell us, first of all, what we're looking at, and is this an asthmatic attack that's going on?
Yes, it depicts basically our airways. We have large airways and we have small airways. Asthma typically affects the smaller airways, and it causes bronchospasm. We call it bronchospasm. It's triggered, as we said before, with different environmental things or allergens, we call them, and it can cause you to restrict your airway and have difficulty breathing, which is the definition of asthma.
And I'd like to paint the picture for our viewers, looking at those lungs. Let's take the left one, for example. We see that red going through and entering the left. Could you explain what that red is? And then there's a yellow situation going on the right.
Yeah, the airflow is restricted, so you see less air movement. You know, the one on our right, you see that the airway is a lot broader and air can easily travel through there. And
like you said, it's more of the tubes in terms of the smaller ones as opposed to the larger ones that get affected,
right?
Yeah,
the smaller ones are the ones that where the muscle is, the airway muscle, and it has the capability of closing, you know, sometimes to the point where you can't breathe at all.
Exactly, and I've actually witnessed it. I'm sure, obviously, as a doctor, you've seen it. But there was a point, a competition that we went to with my children, and I saw one of the girls dancing on stage. She wasn't on our team, but she started having an attack. It was quite frightening. We stopped. Everybody just stopped dancing. Her mom came with the inhaler, and it was moments. And she was describing it to us as a pillow over her face.
Yep.
Is that what you hear?
That's correct. People want to breathe, they have trouble getting air inside the lungs.